I'm Professor Fay Yarbrough. I'm a member of the history department. Oh yeah, thank you, Lon, for admitting folks. I'm a member of the history department. I'm also the associate dean in the School of Humanities for undergraduate programs and special projects. And I appreciate everyone joining us today. Professor Lon Lee is going to present for us today. She's also in the Department of History and also a part of the exciting, growing medical humanities program here at the university. Just to give you a little bit of information about what the purpose of these talks are and what we hope happens today. So this is a conversation. So I hope that all of you will feel empowered to ask questions, by raising your hand or by using the chat function. It isn't just meant to be a conversation between Professor Lee and myself. And what I want to tell you about these conversations in general is that our goal in these Humanities Now conversations is just to impress upon folks how important the questions and the research, the questions that we ask and the research that we do to answer those questions in the disciplines of the humanities, how important they are to the issues and concerns that are vital to all of us today in this present moment, right? We really want to connect our work to interests, concerns, questions that you all may have about what's happening in the world around us. So that's the larger goal of these Humanities Now conversations, and also to, I think, or in my view, highlight the exciting work that's being done by my colleagues in the School of Humanities and to introduce them to a larger audience so that more folks will be interested in taking our classes in the School of Humanities and learning more about what we do. So that's kind of the broad strokes of what the idea behind the genesis of these Humanities Now conversations is. So I want to also mention before I turn things over to Dr. Lee, some events that are coming up that may be of interest to you as well. And I will post the links to all of these in the chat for you. So there is a Planet Now presentation that's going to happen on February the 1st about Hurricane Katrina. On February the 3rd, we're having a town hall with CNN presidential historian Doug Brinkley, who is going to talk about the events of January 6th and the consequences for our democracy when you have citizens storm the Capitol in an attempt to overthrow the results of an election. On February the 5th, we're going to have a session on studying the humanities at Rice that's going to feature undergraduate students from the School of Humanities who are going to talk about their experiences. So that's happening on February the 5th. On February the 10th, we're doing a million things in the School of Humanities, as you can see. We'll have another event called Innovations that's about humanistic medicine. So especially given our topic today, this might be of interest to you. And the last event that I'll mention is on February 11th, when Professor Kirsten Auster will be presenting as a part of a Humanities Now conversation. And she is the chair of the English department, but also the director of the program in medical humanities. So those are some upcoming events I'll put in the chat. And now I will turn things over to Professor Lon Lee. Thank you again so much for joining us, and welcome to the new semester here at Rice. Take it away, Lon.
Yay, thank you so much, Faye. Thanks so much for everyone for coming. My name is Lan Lee. I am an assistant professor in the history department. My background is in science studies and the history of science and medicine, and I focus mostly on looking at science and technology studies in global East Asia. I'll talk a little bit about what that looks like. I also worked for a while as a filmmaker, video editor, and I bring a lot of that work into my own academic interests. As part of the medical humanities program, I've been developing different digital humanities projects. So there are lots of different ways in which I'm interested in interdisciplinarity within the humanities and also between the humanities and the sciences. Today, I'll talk hopefully briefly about one very small aspect of a project I'm working on right now on numbness, and how that gets into my broader interests in using queer theory to queer Chinese medicine in a way, and then also to use that as the foundation for engaging with issues of race in different kinds of medical practices, and in this case, in acupuncture. So I will start. Um, Here we go. Share sound. Can you all see this all right? Is this working? Super. Thanks. Um, and I also have the chat open, so feel free to send or so feel free to just throw any questions you have in the chat. It could be during the talk, it could be after. Um, Today, the title of the talk is Needle and Thread, Medical Histories in the Asian Diaspora. And I'm going to just talk about a little bit of what this means. But part of it, part of my bigger goal is to challenge assumptions of how we approach medical therapeutics in different historical contexts and different cultural contexts. And the question that undergirds most of my research, at least in the contemporary era, is what does Chinese medicine look like? And this question is a racialized question. It's also a question of practical therapeutics. It's also an issue of like ethnic practices and language. Does Chinese medicine have to be Chinese if it appears in Japanese or Korean or in Vietnamese or in French or in Portuguese? What does it mean for Chinese medicine to take different kinds of forms? And how does that engage with the broader idea of diaspora and ideas that travel and change? And this isn't a question that concerns the modern period. It's also a question that can expand across temporalities. So to answer this question, this small and big question of what Chinese medicine looks like, I'm going to start in London in 1836 with a man who was suffering. So there's a man in 1836 in London who's meeting with a physician to treat something he calls hydrocele, which was at that time a common medical condition, which is characterized by the excessive swelling of the scrotum. So he meets with a physician who's one of the quote most celebrated professors of surgery, and this physician he describes suggests that he take port wine and inject port wine into his scrotum, and it will take 7 to 8 working days to recover. This patient, he's like, this doesn't sound like a good idea. I don't actually want to have port wine injected into my scrotum. He leaves this physician's, celebrated physician's office, and then he takes a walk down the Strand, and he comes across a description of something called acupuncture, which involves taking 2 lancets and piercing his scrotum. So he says on the report, it says his condition could be cured safely without any invasive or painful therapies, with little or no inconvenience, and most importantly, without risking his testicles. So he decides to submit to acupuncture, which the advertisement describes as only involving a couple pricks. And then he later writes, I immediately afterwards walked briskly 3 miles, pretty long distance, for, be it observed, there is no pain in the operation, and in about 2 hours I returned home by cab. When undressing myself to go into bed, I found to my astonishment that the whole of the swelling was reduced. The testicle could now be distinctly felt, which it could not have been for 6 months preceding, and this too without any other effusion of liquid than the single drop which followed the needle. I was perfectly unconscious of any reduction having gone on. So this is signed by R.B., published in the Quarterly Journal of Calcutta Medical and Physical Society in 1836. So R.B. uses the word acupuncture in his description of this procedure, even though, and he illustrates these lancets that had that accompanied his publication, and in no way is this referencing any form of orientalized practice. And what's interesting is that just almost 10 years before, about 8 years before, a treatise, a translation of a practice called acupuncturation, had been translated into English by a physician named James Morris Churchill. So there is a kind of pluralistic understanding of what acupuncture might mean in this period. And one of my questions is, how does this practice, a simple practice of needling, become orientalized? So in terms of what Chinese medicine might look like, it does involve needles, but how does it become Chinese? That's one of the issues I'm interested in. So in the talk now will proceed in three parts. The first part is inventing traditional therapeutics, and part of this is critiquing the role that politics has played in the creation of modern and traditional Chinese medicine. So very I guess that's one starting point. This word acupuncture is an interesting word because it's has a lot of Latin remnants, and it's basically a Chinese to Japanese to Latin to Dutch, German, Portuguese, French, also known as acupuncturation, also known as acupunctura, which means poking with a needle. That's pretty much it. Um, and and acupuncture itself is actually it's often used to reference a dual practice of of needling, and of moxa, which is the compression of mugwort, dried mugwort leaves that you can roll up into something like a cigarette stick, or like a small, like it could be the size of a cigar or small like a cigarette, and applied with high pressure. And moxa, as a compressed form of mugwort, is useful because you can carry very high temperatures without producing much ash. So this is actually, I'm referencing two different kinds of practices that have two separate genealogies. Rather than focusing on needling, in the 50s, a lot of physicians working in rural areas were looking at moxa as a way to deliver very inexpensive therapeutics. And they listed that moxa could treat nasal congestion, whooping cough, asthma, coughing blood, pneumonia, hypertension, pleurisy, gallstones, colon ulcerations, sesame inflammation, bloody defecation, cholera, diabetes, insomnia, beriberi, malaria, epilepsy, nosebleeds, polyps, tonsillitis, diphtheria, blood clotting, pediatric meningitis, and facial nerve palsy, among other kinds of issues. So it's a very expansive. It has an expansive range of applications, from inflammation to infections to viral, like from bacterial infections to viral infections. So it's quite broad in its applications. And again, this also connects to a collection of long case histories of what this kind of therapeutic can treat. So if you are familiar with images of acupuncture, there was a question of, well, acupuncture and moxibustion, how might it work? And from the early 19th century up until the 1950s, even now, there has been a lot of debate on how these therapies can possibly work, and it's centered around the debates on the nature of meridian paths. Meridians it's also a pretty broad ontology of being jingluo or sunmai or mai. Roughly, I translate it as meridians because I appreciate the disruption that meridians allows in critiquing the conversations of does this exist or does this not exist. And this is also aligned with this invention of Chinese medicine in the 1930s. During the Republican era, you had Republican physicians in China creating this singular Chinese medicine, which was a response to the government trying to eliminate it entirely. So before that, medical practice in parts of East Asia was deeply genealogical. You had lots of localized schools of practice that are really ingrained in this master-disciple relationship. And again, these are hyper-localized knowledge transferences. So hasn't been standardized. And it wasn't known as a cohesive form of Chinese medicine until the 1930s in response to this effort to ban it completely. And then in the 1950s, the communist government and various physicians who are treating top cadres are also engaged with the creation of the idea of a traditional Chinese medicine, either in the form of zhongyi or guoyi, like national medicine, or indeed Chinese medicine. And that continues on into 1954 and 1966, all the while debating whether or not meridians, these paths, are unique to this distinctly culturally specific Chinese medicine. So this is becoming increasingly heightened during this period. And even as a lot of individuals are debating on the nature of meridians, a lot of physicians do not deny the interesting effects that a needle can have on the skin that a lot of classical texts describe: heavy, rough, tight, slippery, slow, gentle, delayed, fast. There's a range of sensations that doesn't seem to map onto a needle, which you would assume would produce pain because of its shape and because of the idea of something sharp. And yet it generates a range of these sensations. So in this this period of debate and contestation, of inventing tradition, of trying to figure out how classical texts are related to a lot of this new knowledge production, all of this kind of falls apart in, or intensifies or falls apart depending on how you look at it, in the introduction of acupuncture anesthesia. More accurately known as acupuncture analgesia, which is a form of needling that usually accompanies surgical procedures to induce localized numbness. So you can feel something like light touch, but you can't feel pain, which is an interesting phenomenon. So just to introduce acupuncture anesthesia, it can seem relatively straightforward. It involves a patient who lies awake as a practitioner needles select sites on the body to induce numbness for surgery. So a number of reports coming out of China in the 1970s, and later we'll see not only from China, but from Sri Lanka, from Singapore, from Berlin. Numerous reports in China specifically featured women and men resting on operation tables, smiling into the camera, surrounded by doctors who were focusing on one region of the body, either an exposed esophagus, brain, belly, heart, or lungs. And a lot of readers were really amazed as they were skeptical. So to one critic, acupuncture analgesia worked, but it only worked on communist Chinese bodies. And then beyond these ontological debates that surrounded how needling actually worked was this curiosity where the patient and the practitioner were both participating in this choreography of knowledge production, because the patient could lie awake, they could talk to the doctor, and it was this disruption of paternalistic hierarchies, these paternalistic relationships in the operation room, because if the patient watched you get nervous or mess up, that would interrupt the entire procedure because they could interject. So there is something interesting about the in-betweenness of this space. There's between the patient and the practitioner, between Zhongyi as Chinese medicine and Xi as Western medicine, between feminine and masculine bodies. Between all of this were the multiple effects of needling that was changing assumptions about how responses to pain could change over time. So those who tested the effects of needling-induced numbness in places like Colombo, Beijing, Guangdong, Michigan, Berlin, and Harlem hoped that the universalizing effects of acupuncture analgesia could reflect the universal properties of needling, that it could temper, these universal properties could temper the idiosyncratic nature of the body, and then collapse conceptual differences between East, West, male, female, universal, and other. So these are some of the images coming out, especially from the 1970s, of I think this patient is getting an ovarian cyst removed. This person is getting stomach surgery at the Beijing Medical College's 3rd teaching hospital. Also, you can see at the bottom, this person is awake. And this person is receiving an open heart surgery. And often with these pictures, you would see patients, they were awake and they could eat oranges, drink tea. So this is all, as a historian, this is really interesting material because it introduces this question of spectacle. What is the role of the spectacle of surgery? These are very dramatic displays of patient bodies. Patients are awake. There are various issues of consent. And how does it welcome its readers and its practitioners to participate in the spectacle? What does it actually do? So I'm going to show you just a quick video of that's coming out of this period. And you can appreciate this kind of very controversial but highly popularized aspect of acupuncture analgesia that's unified by this genre of a person looking into the camera.
This dramatic medical breakthrough has been the discovery 3 or 4 years ago that acupuncture could be used as an anesthetic in operations. More than 500,000 major operations of this kind have now been performed. No one, even in China, quite understands how it works. Practice, in this case, has moved ahead of theory. It is quite common for patients to be given fruit during the operation to quench their thirst. I watched a dozen or more major operations in which the patients, with no sign of pain, remained quite conscious and could talk with me. It was an utterly astonishing experience.
So there's this kind of amazement with this ability for the patient to eat, to drink during the operation. And in terms of just the context, this is 1970s China, so it's deep in the Cultural Revolution, which is this complex period of anarchy and dictatorship aimed at exposing and eliminating political rivals in the Communist Party. In this period, there's also a lot of popular rebellion in urban areas, which was meant to facilitate and it facilitated and also impeded the actions of a coercive state. So this period of the Cultural Revolution, roughly happening over the course of a decade, you had mass parades where people were publicly humiliated, abused, tortured, and imprisoned. So this is a profoundly violent period in modern Chinese history. And yet, when you have reports like these coming out celebrating this kind of rural homegrown epistemology or this rural homegrown therapeutic, at some point we do have to take it seriously, as Barbara Mittler suggests, to approach material coming out or material produced by the state as both as a source that deeply impacted its human actors and is a meaningful way of understanding history. So this is these are usually my sources when I address this period, and I use it to read between the lines because you do have reports coming out of ENT hospitals on acupuncture analgesia. So in terms of what this might have looked like if we want to reconstruct some of these reports, oftentimes you had a patient, in this case, these eyes are coming from Hua Kenfan, and they often start being nervous. So in Huang's case, he's on the table surrounded by strangers, and these operation rooms are open to visitors. Some visitors are coming from Mexico, some visitors are coming from Hong Kong. And as one journalist wrote, let's see, 1 second. As one journalist wrote after seeing Huang, he said, "I could see that the artery under the skin was pulsating up and down quite fast." And with Huang was a young anesthetist who inserted needles between his index finger and his thumb at a site known as a Hogu site. And she was the one also who had connected these needles to a battery-powered box and was whispering into his ears, telling him what's happening, and measuring his heart rate and blood pressure. And when the surgeon were ready for the operation, she communicated this to Huang, and the surgeons pressed a scalpel into Huang's neck, dragged it down, and some blood gushed out, and the surgeons would reach in. So as this journalist writes, see if I can, he said, "I could see very clearly how the surgeon worked deeper and deeper into the patient's neck. And he approaches Huang, he says, 'May I take a picture of you?' Huang says, 'Please go ahead.' And that results in this photo." So this is to say that from the patient's perspective, Huang understood the rules of the stage. He was posing for witnesses who expected to see, quote, "something strange." The surgeons were the experts, but Huang was the agent. He was a subject. He was a star. The anesthetist was the mediator. She was the one applying the needles. She was monitoring Huang's breath and pulse. She was the one who was guarding his head and his consciousness. She was the one who invited surgeons to approach him. And all of this was very carefully orchestrated, but it doesn't mean that it was any less unreal. And it's reports like these that render acupuncture analgesia as a mechanism for diplomacy. So it's not only, this is just an example of the wires that are hooked onto a battery-powered box. And some of you might recognize similar therapeutics like dry needling that it also involves a battery-powered box. Battery-powered boxes come from a slightly separate development in neurophysiology in Germany and Russia, where there's a lot of interest in Pavlovian theories and using these boxes to stimulate needles. So that comes from a slightly separate genealogy. But again, something that's important about this is that acupuncture analgesia, again, is a device for diplomacy. And this is where we can career needling a little bit and decenter China in all of this. Because in the operation room, specifically in operations in Colombo, you had physicians like Anton Jayasuriya, who was developing techniques of acupuncture analgesia for C-sections. So, I mean, he's really famous in Sri Lanka. He has like post stamps in his image. And
for
there's these
cesarean
videos of
section
him using these very
as
long
performed
needles
by Professor
on site
Jayasuriya
that he's
of
developed.
Colombo, Sri Lanka.
And
first, the incisional
the
needles
video
are
is
given
describing how he
paramedian
right
along the stomach
to
channel.
then cut into the woman's belly and then deliver babies.
The most important distal point is large intestine 4, Hergu.
So he also uses hands on the sites on the hands and
electric
sites
stimulation
on the belly. And you have reports like these, photographs of the Institute of Acupuncture, Bowila, and it describes after an obstructed labor, a C-section was completed under acupuncture anesthesia at Colombo South General Hospital, bilateral tubectomy, operating time 23 minutes. Madam Chow Lianxiang and Madam Premadasa, wives of Vice Minister of the People's Republic of China and Premier of Sri Lanka, fondling the 2 children. The patient left talking to Anton Jayasuriya is seated on the bed 10 hours after delivery. And what's interesting again in this photo is that the woman's twins are being held by 2 diplomats. The First Lady of Sri Lanka, who at this point was visiting a lot of hospitals, and was also an activist in her own right. And then to her right is Zhao Linxiang, who was an ambassador from China to Sri Lanka, to Pakistan, to Myanmar, to Albania, and they're all engaged in this performance in a way. Again, performance not to both critique it, but also not to be too skeptical on the embodied reality of this operation. So then we get back to the question of new discourses are being developed on how does this actually work? How are physiologists responding to this? And the answer is everyone's kind of confused. Both confused, but also trying to develop new theories. So in response to reports from Anton Jayasuriya, a Canadian neurophysiologist, Ronald Mazak, and his collaborator, Patrick Wall, start developing what they describe as the gate control theory, which is pretty popular if you've had any basic neuroscience, that there are gates at the spine or somewhere in the central nervous system that are opening and closing, so that if you hurt your knee, maybe rub the area around the knee or rub somewhere else, and that will close some pain gates and open others. And when they first published their paper on gate control in the 1960s, it doesn't really get that much traction until they correspond with former scientists turned medical historians, Joseph Needham and Lu Guizhen, who are very keen on, they're also focusing a lot on this practice of acupuncture anesthesia. And they talk to Ronald Melzack, and Melzack begins to adapt acupuncture as a way to validate gate control theory. Indeed, in one of his books on introducing gate control, he has an image of a meridian map of an acupuncture man on the front of his cover. So he's using it to validate his own theories. And as he's looking and reading at all these reports, a number of different publications from practitioners, again in Berlin, in Michigan, in Hong Kong, are trying to describe what might be happening. And among these articles is Melzack's Shedding the Gate on Pain. And one of the questions in terms of this gate control theory is that it assumed that there's a one-to-one relationship between the site of incision and the site of processing the sensation. But in a lot of meridian images and images of meridian maps, you have meridians splitting in 2. Paths don't always follow linear one-to-one direction. There's a lot happening, and it's difficult for neurophysiologists, as direct as they want their theories to be, it's difficult for them to come to terms with how paths can split. And and how this happens beyond the control of the brain, even though sometimes they would defer to the hypothalamus or something else. So again, a lot of discourse and a lot of confusion. In Singapore, at the Singapore Medical Association, a physician named T.M. Chong writes a letter to the American psychiatrist Milton H. Erickson, who is an American hypnosis. He's known for developing hypnosis in the US. And Chong writes to Erickson asking, what do you think about acupuncture analgesia? Do you think it's only hypnosis? Erickson writes back and says, I've had acupuncture in the US, and my acupuncturist was kind of like trying to suggest things to me in the way I would suggest things to my patients. And it didn't really work on me. So I think I am pretty sure it's just hypnosis. And this is one of the questions that a lot of physicians are trying to confront, because acupuncture analgesia in Guangdong is actually being used in emergency rooms. So physicians there, like Chen Siming, says that it's definitely not hypnosis, because if you have someone with a broken leg, you don't have time to calm them down and suggest a state of mind to them. And a lot of his patients are patients with severe fractures, and needling would reduce their physical trauma and prevent more complications like shock. So for other physicians, when they do see this being practiced, depending on their context, it's not hypnosis. And for other physicians like Dr. Qingye Ting, who's in Chinatown in New York, he also talks about how he tries to not suggest anything to his patients, sometimes patients who would consult him for using needling to treat deafness. He would always do an assessment before proceeding. So he says, some doctors think that it's just a mental treatment, but I'm really careful not to suggest anything. And then there's this question of, well, is it perhaps a placebo effect? If it's maybe hypnosis, maybe not hypnosis. And this question of placebo is a really fascinating one, because the studies on the placebo effect was not focused on acupuncture, but on cardiology. So this physician, Edmund Gray Diamond, is a cardiologist, is an American cardiologist who has a basic question, which is, do cardiological surgeries work? What kind of effect does he have as a heart surgeon? Because he was treating something like cardiac angina, which is kind of pain in the chest, and he wasn't sure if his surgeries were actually helping his patients. So he would conduct these experiments where he would have a control group where he would only nick the surface of the patient's skin, send them home, and say, we did the operation. And then he would have another group of patients where he would actually perform the surgery for cardiac angina. And for both groups, they came back saying, oh my gosh, doctor, I feel so much better. So he's trying to understand the role of a control group. And he also travels to China and writes dozens and dozens of reports on his own experiences in the operation room, watching physicians undergoing, taking on open heart surgery, open brain surgery, C-sections when a patient is awake with acupuncture analgesia. And he's trying to really come to terms with his own practice, which he knows does engage to some degree as a cardiologist with placebo. So for Diamond, he says that control groups can tell us a lot, and there is an important relationship between the physician and the patient. So when he's in China, he talks to physicians at the Peking Medical College about their experiments on dogs, and for these animal experiments, the researchers tell him, well, if it's not an issue of suggestion or placebo. If in animal studies we do see effects for this on some of our animal models. So this is just getting into this is using this period to try to understand how clearing needling can also introduce a lot of different kinds of questions. It's not really questions about what kinds of bodies this could work on. Earlier, I mentioned that one of the criticisms was, well, this is only working in communist bodies. When this practice is extending beyond the PRC, beyond the People's Republic of China, in Malaysia, Singapore, New York, and Berlin. And it can counteract lots of different issues, like it's used for reducing drug dependency in this period. It's used for treating deafness. It's used to ease patients off of their medication. And with all of these different kinds of therapeutic applications, at a certain point, gate control theory no longer applies. These new physiological theories no longer apply to using needling to treat drug addiction. So this brings me back to a modified version of my first question: what does Chinese medicine look like in the Asian diaspora? If we think about, again, these ideas traveling and different individuals contributing to the legacy of something that might be Chinese, but by the virtue of their own subject position, are queering it at the same time. And in thinking about this kind of cast of characters, it's also important to appreciate how techniques of acupuncture, they're being invented in the case of Anton Jayasuriya, but there are new techniques that are also being invented in Harlem at the Lincoln Detox Center with physicians like Mutlu Shakur, who happened to be Tupac's stepdad. And Mutlu Shakur is affiliated with the Black Panther Party, but not a member. And he is actually trained by the person on the left, Richard Taft, who is a Baylor College graduate. And this is a photo of Taft being treated by a patient trainee at the Lincoln Detox Center. This is very, very new research among younger historians who are trying to figure out what exactly, in a period of intense militarization, violence, what was the role of acupuncture analgesia and the invention of new techniques among these highly militarized groups. Taft was brutally murdered and stuffed into the closet, so this era is quite intense. But it again brings us back to this question of what does Chinese medicine look like if we question the Chineseness of it. And of course, if you're wondering about the afterlife of acupuncture analgesia, it is being used in some hospitals. This is a screenshot of a video of analgesia being used during a C-section at a hospital in Colorado. The video itself is sponsored by the Chinese government. So again, there's a lot of there's an undertone of these medical practices being used as a medium for diplomacy, but that's also undergirded by questions of efficacy and patients who do say, yes, this did work for me. And finally, just to wrap all of these different threads of acupuncture anesthesia together, it really gets into the heterogeneity of a practice like this. So there is a kind of social heterogeneity of decentering China in these needling practices. And these practices that are being practiced in Colombo, Beijing, Guangdong, Michigan, Berlin, New York, Chinatown, it's so effective that it's being adopted in Harlem. And in the operation room, it's heterogeneous in the sense that it's eliminating feelings of pain without the aid of chemical anesthetics, although there are cases where physicians are injecting morphine. In the clinic, it's relieving long-term chronic disorders. In textbooks, it's described as treating paralysis, asthma, heart disease, high blood pressure, and nausea. There's also an ontological heterogeneity where it's eliminating causes from within the body and without the body. And a lot of questions on causation is how can this happen without the brain? Because you can treat the pain from old lesions, rotting molars, herniated discs, or you can also prevent the pain induced by dentist drills, scalpel blades, surgical saws. So all of these different inputs are competing on a small collection of needling sites. There's also this technical heterogeneity where you have new needles, new sites, new power boxes. Sometimes needles were large, sometimes they were small, sometimes they were connected to a battery power box, sometimes they were only manipulated by hand. And these could either relieve or prevent pain. So there's a lot of heterogeneity on the technical side. There's also a temporal heterogeneity where it can be used, again, as we saw in the case of the ER, it can be used to treat immediate injuries. It's quite fast. But at the same time, in the operation room, surgeons described a 20-minute induction time before they could perform open heart surgery or open brain surgery. So it also can be slow if you count 20 minutes as slow. And then for issues of treating deafness, it has to be used in multiple sessions so that or even in the case of easing you off the medication, it requires multiple sessions to gradually assist a patient in not taking their meds. And of course, there's also an empirical heterogeneity where you have lots of different discourses of pain and placebo. Is it happening through gate control theory? Or is it a ritual where we have to surrender any alliance to trying to fix this to a certain kind of mechanism? So, so even in one object of acupuncture, or in this case, acupuncture anesthesia, we start to address a lot of the complexities that can come out of a single therapeutic object. And that is how I would start. One way I would start with answering this question of what Chinese medicine would look like, but again, open to further discussion. So that's it. Thanks very much. Stop sharing.
Yay, thank you so
Great.
much.
Yeah.
That was fantastic. Okay, so now we have plenty of time for conversation, for questions. And again, you can add them to the chat and I'll read them out, or you can raise your hand and you can ask. So the floor is open. My observation is that sometimes you all are shy to get started. So I also have questions that I am happy to ask our speaker today. All right. So while you're gathering your thoughts, gosh, hold on, I don't even know where to get started. So I guess one question that really strikes me in your work in this presentation is back to the idea of how all of this is used to make the group that's practicing needling very other, right? To me, that's what strikes me about how I don't that video where that man was narrating what's happening, and when he says no one understands, even in China they don't understand how this works, or your description of spectacle to me seems so apt. And so I just wanted you to talk a little bit more about how it's um the practice is another way to make the practitioners seem strange, different, unusual, odd, not like the person doing the observing. Because again, that's the thing that really strikes me about, especially that the tone of voice of that narrator. Just it felt very the strange thing those other people are doing over there. So if you could talk a little bit more about that.
Yeah, it also connects with, I just saw Luisa's question about staging and the politics of seeing. Yeah, there and this maybe connects to Rich's question about my own attitudes towards acupuncture analgesia. So there there's an inherent paradox in Chinese medical practice, and especially with acupuncture, because it was used to um, to perform a certain kind of otherness by it's other in the by virtue of trying to connect to this legacy of Chineseness. On the other hand, it is very effective, right? It's effective in the message and it's effective as a practice. And this is not to, I mean, as my mom was trained as a barefoot doctor. She mostly does acupuncture on myself. I do acupressure on my family members, and there's a threat of professionalization in a way. So one of my other projects is understanding how acupuncture in the U.S., at least in Texas, is how practitioners are licensed. And in the 80s, one of the individuals who actually allowed or succeeded in licensing practitioners in Texas was arrested multiple times just for practicing acupuncture. And this connects to another project that I'm working on that's funded by the Chow Center. Thank you, Lisa. Called American Asian Medicine, and one of the threads involves interviewing this one person, because even in the case of Richard Taft, he too was arrested multiple times. Mulu Shakur had gotten his license in California, I think in 1975, and so the politics are different in China versus in the U.S. And when it comes to the gaze, there's something that is very specific to just propaganda during the Cultural Revolution, let alone kind of media in the 1970s. That is very, wow, look at this thing. We don't know how it works. How cool. There's this kind of there's a mix of surprise and intrigue, and for most of the viewers, it is an invitation. So one of in the abstract, even for this talk, the dentists in Michigan who are Chinese descendants, or maybe Taiwanese descendants, I have to confirm this, they read Edward Diamond's reports, and for them, they're like, this is a template for me to try this on my wife or on my husband. And so again, the gaze involves a lot of intrigue. It also, there are layers of politics on top that mediate how the media is being produced. So yeah, it is difficult to work with the material because of these reasons, because of the paradox, because of the paradox of that it's both trying to validate something, but then also it disrupts um, um, messages of efficacy. And for practitioners who do focus on meridians, they want physicians in China to say, actually, let's look at these classical texts. There's actually more going on here. I'm trying to.
From Travis and from Rich in the.
Yes. Oh, yeah. Oh, yeah. So from Rich and from Travis. Yeah. So in terms of contemporary acupuncture analgesia, it is supported by the NIH. Although I think the NIH recently has taken a hit in their funding for what they now call complementary integrative medicine. It's no longer called alternative medicine. There was a shift in changing those names, and acupuncture research in the U.S. is highly contested because of because some physicians don't want to talk about qi. They don't want to talk about other kind of invisible aspects of the body, and they often create this false dichotomy between the invisibility of the Chinese body and the visibility of the biomedical body, because we can't actually see different things like neurophysiological movements, or we can't really see pain traveling through someone's body. And yet there's a double standard. There's an intense double standard. A lot of studies on acupuncture in the US and in other parts of the world have to be double blind. That doesn't apply to other biomedical other biomedical therapeutics. We don't know how asthma works, and yet it's very much accepted. So there's a lot of there's a lot of contradiction even in validating this. I know I connected to the Chinese state, but that's not to discredit the actual practice. And then for Travis's question, is the Chinese government that perpetuates the notion of acupuncture only working on? So the communist bodies, that comment came from an American writer who, because this is, again, I mean, obviously the context is the Cold War, or to do mystified Westerners. Yeah, so that's coming with that. Thanks, Elizabeth, for coming.
I have a quick follow-up question.
But Travis, go ahead. Mm-hmm.
Yeah, so my question, I guess the reason I'm curious about this is because you put the notion of queerness and queer theory so front and center. And I guess this is kind of a speculative question that may be hard to answer, but I wonder if there's a notion of, like, when you have a kind of mystified Western medical establishment trying to make heads or tails of acupuncture's efficacy, and then attributing this notion of it having a kind of unique appropriateness to the communist body. Is there a kind of like fear or abjection of penetration going on there? Like, is there a way in which, despite the fact that Western surgery is also intrusive, acupuncture thematizes and almost like tropes the idea of like a penetration from without that is like, I mean, in a way that kind of like queers the communist body as being like uniquely available to these interventions, whereas you've got a kind of like immune, sovereign Western body that is uniquely averse to their efficacy or something?
I mean, that's the contradiction, because I mean it's easy to put these to have these false dichotomies, and yeah, that is a fear of this fear of penetration, and yet it's happening in all sorts of contexts, again in New York and Michigan and California. So that is it's this kind of separation of discourse and practice, which we see a lot, and that's why and this is to answer Rich's question in a way. One of the reasons why my own project doesn't only focus on the modern period, one of the reasons why I engage with early modern and medieval texts and the history of neurophysiology and comparing that to histories of meridian mapping is exactly to arrive at this point where all of this discourse kind of layers on top, and it's overwhelming in a way. So my own work is to kind of sift through how the discourse contradicts practice, because we know that bodies are inherently pluralistic and it's easy for people to say anything they want in terms of efficacy, and that does generate a lot of double standards and inherently, racist assumptions about how bodies work.
Are there other questions that you have?
Rich, do you want to say more about? I mean, and it's fine. Or Luis, I know I didn't. I feel like there's so much more to these questions. It's a lot to unpack.
Oh, pardon me, I'm losing my voice, but that was a wonderful talk, Lan. I really enjoyed it. I was thinking about the staging issue, and I'd seen acupuncture surgery quite a few times in the PRC, and the Tianjin Medical College had some really interesting displays and arguments about, not what I mean is not displays, but faculty who talked about their own experiences. And in one case, there was an alleged albino in Shanghai who whose meridians were visible. Have you ever encountered that before? I never have, but it sort of speaks to a certain enthusiasm on the part of people to either believe what they haven't seen themselves, or I don't know how to put it. Is there a certain credulousness that comes with these practitioners that also is not subject to empirical exploration? I guess that's sort of what I'm trying to say. Sorry.
No, yeah. I want to know more about your visit to Tianjin. That sounds fascinating. And in this period, I was visiting a couple museums in Beijing, acupuncture museums that were close to the public. They didn't let me take any photos of what they had on display, but one of them was these earlier physicians using fluorescent dyes that they would inject into particular needling sites to track the path of the meridian. And it would kind of go part way and then end. There are animal studies still ongoing using glucocorticoids or different kinds of visualization methods to map out the meridians using MRI scans or things like that. But it's always tricky, and this actually gets into the heart of my interest, is that a lot of these images of full meridian maps are always drawn by hand. Even now, even contemporary maps are always drawn by hand. It's a very old technology, drawing with a pen. So with the case of the individual you mentioned who was albino, seeing meridians, there are practitioners or researchers who unearth like mummified bodies, and they see paths that like imprints of lines on those bodies, and they say this is a meridian. And oftentimes it's hard to see the meridian path, all of the, let's say 24 paths, primary paths in full, all the qijingbamai, the auxiliary meridians in full, though they only exist in full on paper. But then you do have cases where neurophysiologists who are interested in dermatome paths, which is, if you get shingles, you have a viral infection on one area of the body, and they describe that as potentially reflecting a meridian path. So and also one thing I didn't mention is that in North Korea in the 1960s and 70s, there are researchers describing meridian paths and sites as being localized capillary clusters. So they visualize it that way. So there are lots of different, we could say, metaphors or analogies of what meridian paths are. And oftentimes it's based on where they are. If it's located here, then maybe we can find some capillaries, or maybe we can find some nerve clusters. So again, I'm really fascinated with the albino case. I wonder if it was kind of, if they had seen vessels or something else, a darkening of the skin. But yeah, I'd love to follow up with you.
It's hard to know. This fellow was the vice president, actually, of the medical school, and so presumably had a lot of credentials. Could I ask a follow-up about your own experience? You mentioned that you used it with your family members. Could you say?
Just mostly acupressure. Yeah.
Oh, acupressure.
Yeah,
because
yeah, and then
oh, sorry.
Mm-hmm. Oh, so go ahead. Mm-hmm. And I think a lot of it is, I grew up with a lot of Qigong practice around my house. And so this question of epistemology and visibility, and even in the 1970s, Yap Chin Sen engaged in human body sciences. When you engage with, physicists, then the kind of unseen unknown becomes a minefield. At the same time, I think it's, again, questions of materiality are always kind of the foundation of these debates on meridians. As you probably know, with Wu Guizhen and Joseph Needham, it was difficult for them to talk about meridians as being material if they are always invisible. And even though in a Euro-American discourse, invisibility is not that big of a problem, especially when it comes to like neuroscience. You can't image your emotions, and yet we have words for them, and we don't question that they exist. So there is this issue of invisibility and materiality that becomes problematic in this context, even though in other contexts it's not problematic.
Mm-hmm. I guess because you know the members of your family well and you employ these acupressure techniques, were there variables that you could discern in the different members of the family? I'm sorry to monopolize this. You and I should just talk about this another time. But,
yeah, no, I can.
But just basically.
Well,
yeah, no, I'd love to follow up. Yeah, this would be so.
Yeah, we'll do this another time.
Yeah, because we have time, I think, for one more question from Manchu, and then we'll have to wrap things up since our hour is coming to a close. So feel free.
Hey, Nan, really fascinating talk, and it takes me all the way back to my childhood and youthhood in China. I think acupuncture was popular during the Cultural Revolution specifically. It was like a mass movement, both politically and also a fashion, I would say, lifestyle fashion. Think about fashion here in the United States. And I was a young girl, was attracted. I bought a box of needles and practiced it on myself. And on my sisters, you know, there are plenty of communist bodies for me to practice on. However, no, I found it didn't work for me at all. So I don't know if it was because I didn't have the qualified skill. And it didn't work for my family either. And finally, everybody gave up, too painful for them. And I also believe, though, I wouldn't call communist body, you know, those showcases maybe for most of the people, it is collaboration between the doctor and the body. This is really different bodies would have different responses to the medical cares. So I just want to offer a little bit of this kind of observation. There is another case, I don't know if you paid attention to, is that acupuncture was used to treat the mute people and made miraculous results. You know, people could call out long-live Chairman Mao instantly. So I don't know, maybe you paid attention, you just didn't have time to talk about it. And it's more psychological, I guess. But anyway, just some of my experience. Thank you, Nan. It's great.
Yeah, thank you so much, Nancy. This kind of gets into so many issues that are at the heart of medicine more broadly. It's not just acupuncture. Sometimes stuff works, sometimes stuff just doesn't work. And it's like I was just talking to Fay before the talk. I just got my Moderna shot yesterday, and they gave us a sheet that says this may work for you, but this also may not work for you at all. So it's like we don't know how long it will protect you against the vaccine. So this is, again, this issue of efficacy is applicable in so many different cases, and it gets to this issue of idiosyncratic bodies. It's true, stuff just doesn't work sometimes, and maybe other things work better for some people, but not others. And the other issue of, you mentioned the case of treating deaf mutes, that involves its own kind of approach. I have come across these pamphlets as well, and even in the case of Tim Chong in New York, he also treated people who were deaf or had who are non-vocal, and he observed this doesn't work for everyone, but over time he does have patients who he was able to treat in some way. So of course there is a very affective quality of being able to open your mouth and say like long live Chairman Mao. There's so much emotion wrapped up in that experience that that I imagine it's for the individual and for the viewer it means a lot. But that context, that kind of that experience can be transferred into other parts of the world or in other translocal contexts. So yeah, but that I'd be more than happy to just to talk more about this and also obviously learn from your experiences, because it is true. Needles are supposed to hurt, and they don't always work. That's why I never wanted my mom had a big box of needles too, and I was like, nah, I think I'm okay for now.
Thank you. Thank you.
All right, thank you so much, everyone. Thank you so much to Professor Lan Li for giving us this really wonderful presentation today. I have once again put the links to more events in the chat in case you're interested in any of the other events that we're hosting in the School of Humanities. And I'd like to thank everybody for taking some time with us today. We really appreciate it. Hope you're having a good first week of class for students and faculty, and just a good start to the year for everyone in general. Thanks everyone for joining us. Thank you again.
Thank you so much.